Dr. Bravian, Consultant General Physician in Supreme Hospital, Padur. And I'm going to talk on an emerging problem, an ever-emerging problem, which is hypertension. Hypertension or high blood pressure is a problem that affects globally, and its numbers are always ever since increasing. Hypertension or high blood pressure, as contributed by the WHO assessment, states that there are 33% of the individuals are affected, and the numbers are always in rise. So with this emerging problem, we have to think about how we can cure. It's not cure, how we can treat hypertension. So hypertension or high blood pressure is when the BP or the blood pressure is having a systolic value, upper limit and a lower limit. So a high blood pressure means the upper limit of anything above 140 and above, and a lower limit of anything 90 and above is deemed as hypertension. Most of the times when we talk about hypertension, the question arises as to what is hypertension. So hypertension or high blood pressure actually denotes the force through which blood passes through the blood vessels. So if the force increases, then there are few problems that are going to come up. So one of the problems is stroke if it affects the brain. Another problem is heart attack if it affects the heart, and chronic kidney diseases. So as per WHO, each year annually we celebrate the World Hypertension Day, which falls on 17th of May. And during this period, we go into societies spreading out the awareness as to what is hypertension, how do they get themselves screened of hypertension, what are the ways we can prevent it. So to talk about hypertension, there are risk factors of hypertension. So when you talk of risk factors, there are some risk factors which are modifiable, and there are some risk factors which are non-modifiable. So non-modifiable risk factors are things that are inherent. That is, with every age increase, there will be thickening of the blood vessels, and so the blood pressure is going to increase. So that is something that we cannot do to change. Next thing is in non-modifiable, we have genetic cause. For example, the parents are hypertensive, so the children and the siblings are hypertensive. In modifiable cause, we have the first and foremost culprit is the diet. A diet that is high in sodium, a diet that is high in fatty content. So inactivity and alcohol and cigarette smoking, these are things that will actually are the modifiable factors which we can take into account and do certain things to bring that down. Now, so how do I know that I am hypertensive or not? Well, the thing is, hypertension is a silent issue. So it wouldn't creep until the values go off record and there is irreversible damage to the organ. So one of the things that we tell for hypertension is get yourself regularly checked. The next question is, at what age should I start looking? We have accounts of people who are hypertensive even as ages of teens. Even teenage individuals are hypertensive. We have accounts of that. So whenever and wherever it is possible, it is always better to get a BP checked up, and from there that makes us our first step in the awareness of checking our BP and then getting a consult.